The Lord Ara Darzi of Denham, the chair of surgery at Imperial College London, was invited to speak about healthcare reforms during a public health seminar. The seminar was held at the American University of Armenia, organized by its College of Health Sciences jointly with the National Competitiveness Foundation. Lord Darzi's talk focused on the costs and benefits of healthcare reform in the United Kingdom and United States, and emphasized the important role of preventative care. Varturi Pedrosyan, Associate Dean of the College of Health Sciences, and Arman Khachadurian, CEO of the NCF, briefly spoke and introduced Lord Darzi to the audience.
Most people think if you're a minister, you can make all the changes you like. Don't believe that. Ministers don't have power. I promise you. The only power they have is money. Does that make sense? And if you really want to make change happen, you need to find the right incentives in making the change happen at a local level. If you're smart, you need to get your doctors and nurses to make the changes for you. And you sit in the ministry and smoke a cigar for your bad health contribution. Does that make sense? That's the way in which you make change happen. So the way I did it, I didn't smoke cigar, was really to drive a movement with the doctors and nurses in driving quality and quality improvements. So it had to be local. The transformational change for me had to be local. It could not happen at the Ministry of Health.
How could we redesign the pathways of care by bringing disparate groups together and say, how are we going to manage the whole pathway of care, but more importantly, the interface between primary and secondary. That's where patients get lost. The interface between primary and secondary care, between primary and social care, patients discharge, and that needs effort. But ultimately, all of these things come down to local leadership and clinicians communicating with each other. And what we need to do also to look at education and training. We need to start teaching doctors and nurses what an accountability is to the whole system, what an accountability is to the whole pathway. Because if we don't look at it that way, the doctors are looking at essentially the gearbox, the nurses are looking at the windscreen in a car assembly line. No one is actually looking at the whole thing put together. And that accountability needs to be re-established. In healthcare, it's the same. Every country, including the United States, that's about 18.3% of its GDP, and getting those results, is questioning itself. Are we actually, are we spending the money in the right places? The reverse, politician needs to be able to communicate and not know anything about detail. That's what is a good definition of a good politician.